resistant windows that help protect against hurricanes and break-ins. Engineered for strength, designed for peace of mind. Learn more at newsouthwindow.com. Eckerd College proudly hosts the National Theater Live Encore Series, beginning with Dr. Strangelove, Saturday, October 25th, presented by Westminster Communities of Florida. Learn more at ollie.eckerd.edu.
DeSoto County's only hospital is on the verge of getting sold or merging with a bigger health system. Who gets to decide the fate of a government-owned hospital? And how can you make sure your small town's hospital keeps its doors open? I'm Matthew Petty, and coming up on Florida Matters Live and Local this hour, we'll talk about why rural hospitals are disappearing across the country. And if you've got questions about how it could change how you receive healthcare, let us know. We're at 813-755-6562. We're also 21 days into the federal government shutdown. We're closing in on the record 35-day shutdown during Donald Trump's first term. What do you want your elected officials to do about it? Where is there room to compromise? And later, Clearwater is working to become an autism-certified city. How is the city trying to make itself more accessible? All this plus your calls coming up on Florida Matters Live and Local after these headlines.
Live from NPR News in Washington, I'm Lakshmi Singh. Tasked with keeping a fragile ceasefire in Gaza on track, a high-level U.S. delegation is spending another day in Israel. Vice President J.D. Vance met today with Israeli Prime Minister Benjamin Netanyahu. NPR's Greg Myrie reports on the mission as the Israel-Hamas ceasefire brokered by President Trump nears 2 weeks.
Vice President Vance met Prime Minister Netanyahu in Jerusalem. Afterward, Vance told reporters, quote, "We have a very, very tough task ahead of us, which is to disarm Hamas but rebuild Gaza." Vance is part of a high-profile U.S. team in Israel this week with the mission of extending the ceasefire to a more challenging second phase. U.S. Middle East envoy Steve Witkoff and President Trump's son-in-law Jared Kushner are also in Israel and have also held talks with the Prime Minister. Netanyahu is universally known in Israel as Bibi. The Israeli media is calling the visiting American contingent the Bibi-sitters. Greg Myrie, NPR News, Tel Aviv.
President Trump is asking the Department of Justice to pay him roughly $230 million for past federal investigations he was the subject of. That, according to reporting from the New York Times. NPR's Elena Moore reports Trump has not explicitly confirmed the complaints.
NPR has not independently confirmed the report, but when asked about it by reporters, Trump stopped short of affirming it. But he did say the Justice Department, quote, probably owes me a lot of money, and that he'd give any potential payment to charity or use it to keep restoring the White House. He also acknowledged the unusual nature of any potential payment from the DOJ.
That decision would have to go across my desk. And it's awfully strange to make a decision where I'm paying myself. In other words, did you ever have one of those cases where you have to decide how much you're paying yourself in damages? But I was damaged very greatly.
The report comes as critics of the White House have voiced concerns that Trump is using the agency for his own political and personal agenda. Elena Moore, NPR News.
Disappointing earnings reports are weighing on the stock market today. More from NPR's Scott Horsley.
Netflix reported lower than expected profits for the first time in more than a year and a half. The streaming giant blames an unexpected tax bill from Brazil. Netflix says its programming is still drawing plenty of viewers, and revenues were in line with expectations. It could be a nail-biting holiday season for Mattel. The toy maker says big retailers have been cautious about placing orders this year. Demand for Hot Wheels and action figures are up, but sales of Barbie and other dolls, which are usually the company's biggest sellers, are down. Inflation in the UK was a little cooler than expected last month. Here in this country, we'll get the latest inflation scorecard on Friday, just in time for the Federal Reserve's next interest rate decision a week from today. Scott Horsley, NPR News, Washington.
This is NPR.
Support for NPR comes from NPR stations. Other contributors include Fisher Investments. Fisher's dedicated team of specialists provide resources on investing, retirement income, estate planning, and more. Learn more at FisherInvestments.com. Investing in securities involves the risk of loss.
You're listening to WUSF 89.7. I'm Craig Kopp. Changes are coming to the Supplemental Nutrition Assistance Program, SNAP. Among them is a requirement to make states pay for their mistakes, literally. WUSF's Gabriella Paul explains.
As early as 2027, states will have to cover a chunk of their SNAP benefits. How much they owe will be decided based on the number of errors the state makes when administering the program. That could include under or overpayments. Earlier this month, Florida lawmakers learned they had a 15% error rate.
So if I go on these numbers right now, using 2024's numbers, the cost to the state is going to be over $1 billion for our SNAP benefits.
That was State Representative Shane Abbott during a committee meeting. Officials say errors increased in recent years because of the pandemic and major hurricanes, which causes a spike in disaster SNAP applications. Gabriella Paul, WUSF 89.7 News.
Burmese pythons came to Florida as pets, but then some of those pets were released into the wild. And now the big snakes are one of South Florida's top invasive species threats. They grow up to the length of a car, and they ravage the ecosystem. However, Governor Ron DeSantis has some good news. Well, it's bad news for pythons. A record-setting number of pythons have been captured.
In July of this year, we had 748 removals compared to 235 removals in July of 2024. And honestly, 235 removals was not considered a small number at the time.
Florida has partnered with the Miami-based company Inversa. They turned those pythons into leather. The company says it predicts python harvesting will greatly increase as it launches aerial AI detection devices in the future. DeSantis says he wants to ensure python removal efforts are funded every year. I'm Craig Kopp, WUSF 89.7 News.
Want to catch up on Tampa Bay area news and culture? I'm Sky LeBron, and I got you every weekday morning with the Bay Blend podcast from WUSF. It's quick, fun, and you'll discover something new every day. It's the Bay Blend, wherever you get your podcasts or at WUSF.org.
British jazz pianist-composer Simon Lasky returns to the Palladium with an all-star band of Tampa Bay jazz musicians. Don't miss his arrangements of standards, originals, and new compositions this Saturday, October 25th. More at mypalladium.org.
This is Florida Matters live and local. We're broadcasting from the doctors Lorraine Rubis and Neil Frankel studio in Tampa. I'm Matthew Petty. Well, DeSoto County's only hospital could be sold or merged with a bigger health system. Like a lot of other rural hospitals around the United States, the 49-bed DeSoto Memorial Hospital in Arcadia faces problems like doctor shortages, an operating deficit, and Medicaid cuts. It is very hard to stay in business and deliver care. So, how do rural hospitals like this one stay open? And does the quality of care suffer for folks living nearby if they get bought out? Joining us for more is Kara Newhouse, investigative reporter with Suncoast Searchlight, and Mary Mayhew, president and CEO of the Florida Hospital Association, which lobbies for more than 200 hospitals and healthcare systems statewide. And if you live in DeSoto County, what do you think? If you have questions about the potential sale of this hospital or the state they're in, call us. We're at 813-755-6562. That's 813-755-6562. You can also send us an email, FloridaMatters@WUSF.org. Well, Kara, thank you so much for being with us. Now, you've been reporting on the story since the summer. Who owns the hospital now, and why are they looking to either sell it or merge with a bigger system?
Technically, the public owns the DeSoto Memorial Hospital. It is governed by the hospital board. It's part of a hospital district. And so the board meets during public meetings like any other government agency is required to do.
Yeah, and there's not actually that many hospitals in Florida that are owned by the public or the government, right? I mean, this is one of a few, and I guess a vanishingly few when you consider it may not be very soon.
Correct. KFF reports that this was from 2023, there were 24 government-owned hospitals at that time. That in Florida specifically, that doesn't include federally owned like VA hospitals, but state or local government only about 24.
Yeah. Now, is DeSoto Memorial Hospital at risk of closure if it doesn't either sell to another system or merge or is taken over in some other way?
The board says no, that certainly their intention is to make sure it doesn't close. And they also say, as far as the CEO and the board, as far as the finances, although they are struggling, it's not an immediate, we're about to go bankrupt. It's more of, we need to figure out something for the longer term. So that's the goal, to keep it open.
Right, and to that end, they've been talking with some healthcare companies. Can you just tell us who's in the running for this? Because I understand there's like 3 options on the table.
Yes, they actually got 6 proposals, but they narrowed it down last week during a special meeting to 3 that they're going to hear presentations from in November. And those are Advent Health, which is one of the 10 largest health systems in the country, that has proposed to purchase the hospital outright for $50 million. There's Tampa General Hospital, and that they have proposed a 49-year lease and an investment of $45 million for capital improvements and things like that. And then North Star Hospitals, which has proposed a management agreement. So the community would still own the hospital, but they would help to run the hospital and shift how operations are working.
And I wonder, I mean, if you look at previous mergers, what would happen to patient care? I know that the message from the board has been nothing's going to change, the care is going to continue. But do you have a sense of how it would change for patients and for staff there as well?
That definitely takes some more research, I would say. But research that has been done is kind of mixed on this as far as hospital consolidation more broadly. It's pretty consistent that the cost to patients does go up when consolidation happens, but the research is a little more mixed on quality of care.
Yeah. We're talking about the potential sale of DeSoto Memorial Hospital. We are with Kara Newhouse, investigative reporter with Suncoast Searchlight. Also with us is Mary Mayhew, President and CEO of the Florida Hospital Association. And if DeSoto Memorial is your hospital, maybe you've been a patient there, what stresses are you seeing? Maybe if you work there, let us know. We're at 813-755-6562. More generally, too, the kind of pressure on rural hospitals. If you have a rural hospital near you, are you worried about it closing? Give us a call, 813-755-6562, and let us know what you're thinking. Mary Mayhew, let me turn to you. So Arcadia is about an hour east of Sarasota and Bradenton. It's a bit of a drive for somebody needing emergency care. I mean, could this be a matter of life and death for small towns in our region? Like a small hospital like this, what level of care can it provide, and how vital is it for folks?
I mean, at the end of the day, proximity to healthcare matters. We want to certainly preserve access to emergency level care, right, when you can't afford the time to drive any great distance. But what we also know about rural hospitals, first of all, they're generally an economic hub, the largest employer, but they are playing often a much more expansive role. They're often employing the pediatricians or the OBGYNs, the primary care physicians. In rural communities, you are dealing with often a much higher percentage of Medicare and Medicaid. Those two payers pay far less than the cost of care. So for a rural hospital, they have high fixed costs, their workforce, their labor costs, pharmaceutical supplies, and they often are receiving far less in reimbursement than what it costs to deliver that care. So today in Florida, nearly half of our 24 rural hospitals are operating in the red.
Now, you represent hundreds of hospitals across the state. You're the former head of the state agency for the healthcare administration, so you know how this stuff works. I mean, is this a chronic problem for hospitals in Florida, whether or not they're rural hospitals?
Healthcare's not easy. Our labor costs over the last few years have gone up over 25%. Think about pharmaceutical costs, skyrocketing costs associated with drugs, medical supplies. That's 70% of a hospital's budget with double-digit increases. I was just at a hospital, Children's Hospital recently, learning about virtual reality that is dramatically improving pediatric open heart surgery. The expense of bringing modern, sophisticated healthcare that we all want when we need it we've got to recognize those types of investments. So healthcare generally, to keep pace, to have the latest imaging technology, the latest specialists, we need to make those investments. But on the whole, when you think about who uses hospitals, it's our older population. They're often Medicare funded. Medicare pays hospitals in Florida 80 cents on the dollar of cost. So you're losing money on every patient. It's hard. You don't make that up in volume. So that's the irrational financial structure that makes it difficult to preserve access. We have OBGYN deserts around the state. That's largely Medicaid. Medicaid pays, 50 cents on the dollar of cost. So those are some of the financial pressures that both rural hospitals and non-rural hospitals are up against.
Talking about the potential sale of DeSoto Memorial Hospital, what are your thoughts about how these hospitals, should go forward in this age when we're kind of thinking about healthcare funding? If you have a rural hospital near you and you're worried about its future, give us a call. We're at 813-755-6562. Back to you for a moment, Cara. Thinking about Medicaid, I mean, that is one of the threats kind of looming over, or has been looming over this hospital, right? So what would happen? I mean, can it survive without some of these Medicaid reimbursements? What's the situation there?
Yeah, it remains to be seen. The President Donald Trump's One Big Beautiful Bill will create $991 billion in cuts to Medicaid spending over 10 years. The hospital doesn't know yet whether or how exactly that will affect them, but 1 in 5 patients there do have Medicaid, and as Mary mentioned, the costs that the payments that they get from the hospital gets from Medicaid already are lower than the actual expenses. So any further decreases would, I almost certainly, have a negative impact on their ability to continue providing care.
I wanted to ask you too, Cara, I mean, what's in it as a sale of this hospital? What is in it for a company that buys it, whether it's Advent Health or some of the others you mentioned? Like, what do they get out of it?
That's a great question. Mary might know better than I do. The both of these companies, well, the two that are proposing a sale or lease or purchase or lease, have acquired other hospitals in recent years. Advent Health has purchased earlier this year the Port Charlotte Hospital, which is in the county that borders DeSoto to the south, and that included a hospital that in Punta Gorda that had been closed, and potentially they'll do something with. And then Tampa General also acquired 3 rural hospitals 2 years ago. So how that affects their bottom line is a question mark to me, but it's something that they're interested in for sure.
Yeah, Mary, we've only got about 30 seconds left here, but I mean, is this the kind of the future consolidation and more consolidation?
First of all, it's not unusual across the country, and it's not just rural hospitals, it's physician practices. If you're hemorrhaging red ink and you're trying to preserve access, hospitals are often stepping in to support that. Just think electronic medical records, incredibly expensive, but an absolute necessity for hospitals. When a rural hospital becomes part of a larger health system, they're benefiting from a lot of back office operations that can be supported through the health system to alleviate that expense. Also investments in new equipment, telehealth, remote patient monitoring. Those are all significant financial benefits to a small hospital.
We'll have to talk more about it, but we're going to have to leave it there for now. Mary Mayhew, President and CEO of the Florida Hospital Association, thank you so much.
Thank
also
you.
Joined by Cara Newhouse, investigative reporter with Suncoast Searchlight. Thank you, Cara. Well, coming up next, the federal government shutdown is 3 weeks old. There's no sign of Democrats or Republicans budging. How is the shutdown affecting you? What do you want your representatives to hear about this? More to
I'm Jane Clayson. Syrians are continuing to piece together what they lost during the Civil War. Many are looking for answers about children who were taken by the now deposed Assad regime.
These children were being used as leverage. It was a psychological torture for their parents to not know where their children were being placed.
That's next time on Here and Now.
coming up at 1 after Florida Matters Live and Local.
Funding for WUSF comes from listeners like you, and also Seitenbacher, with a new web shop, healthy muesli, cold-pressed oils, and vegetable broth mix delivered to your door from right here in Tampa Bay. Details at Seitenbacher.com, Seitenbacher, Seitenbacher. The Orchid Show 2025, Rebecca Louise Law, is on view now at Selby Gardens and its Sarasota campus. This exhibition will immerse you in flowers and foliage. See it through December 7th, presented by Better Grow. Details at selby.org.
Welcome back to Florida Matters Live and Local. I'm Matthew Petty. Well, the federal government shutdown is now 3 weeks old. Democrats want Republicans to extend Affordable Care Act subsidies. Republican lawmakers claim Democrats want to give free health care to people in the United States without legal status. House Minority Leader Hakeem Jeffries told NPR he thinks public pressure will force Republicans to come to the negotiating table.
14 million people are at risk of losing their health insurance coverage throughout the country, including in rural America. Hospitals, nursing homes, and community-based health clinics are about to close across the country, and we're already seeing that happen in some states.
That's Hakeem Jeffries there, but so far neither side is budging. Is the shutdown affecting you? Are you a federal employee perhaps, and what do you want lawmakers to do about the shutdown? And if you're getting health insurance through the federal marketplace, how does the standoff over healthcare affect you? You can call us. We're at 813-755-6562. That's 813-755-6562. Send us an email to FloridaMatters@WUSF.org. Well, Congresswoman Kathy Castor joins us. She's doing an Instagram Live on the shutdown within the hour. Castor is a Democrat whose Hillsborough and Pinellas County districts include Tampa and St. Petersburg. And Congressman, you've been quite vocal about the shutdown. Thanks so much for joining us. Federal workers, though, they're going to miss out on a paycheck this Friday. That's roughly 31,000 people in the Tampa Bay area. You know, workers are furloughed. Some are working without pay. What do you say to those federal workers as the shutdown drags on?
I would say that the House of Representatives needs to get back to work. This is day 31, actually, since the Speaker of the House, Mike Johnson, shut down the House of Representatives. The Republicans have been on vacation since that time. They've canceled votes, they've canceled negotiations, they've canceled meetings, and this comes at a time where over 4 million Florida families are bracing for higher health insurance premiums. Just yesterday, calls were flooding into my office about the premium increases. One couple from Apollo Beach now, they were paying $26,000 a year with an $8,500 deductible, said that their new quote is $39,000 a year. They can't afford it. A lot of small business owners, a lot of people who are working part-time, doing everything right. And this comes at a rotten time when the cost of groceries and electric bills and property insurance, rent is just squeezing folks. So folks have got to come back to the table to negotiate the way to reinstitute these cost-saving and life-saving healthcare tax credits.
Right, but on the other side, you have Republican lawmakers saying, look, they're saying the same thing. They're saying Democrats aren't negotiating. They're refusing to budge. They're saying some of the things that Democrats want to do are kind of wasteful. They've been called wasteful kind of COVID-era spending. And some Republicans are proposing a one-year extension of ACA subsidies. House Minority Leader Hakeem Jeffries says no to that. What do you think? I mean, would it be worth just extending this for a year just to get us by this little next patch?
Well, it's hard to negotiate when the Speaker has completely shut down the House of Representatives. And it's really up to the President. The President has got to be engaged, and he appears to be distracted by, providing a big bailout to Argentina. People are really angry about this. If they can find $20 billion for a bailout to Argentina, and they can remodel the White House, and they can the Homeland Security Secretary now is going to be purchasing luxury jets. They just don't understand why folks can't come back to the table to help extend these tax credits. I've met with federal workers yesterday, air traffic controllers from Tampa airport, and they expressed to me that they are very scared. There's going to be real pain if they miss the paycheck here in the coming weeks. So that's why time is of the essence, and folks have got to get back to Washington, D.C. to actually hammer out a solution.
Right, but are they saying to you, we're worried about this, but we want you to kind of keep holding the line because the healthcare, the Affordable Care Act subsidies are so important, or are they just saying, look, sort this out, get back to the negotiating table and get this shutdown over?
I think the overwhelming number of communications right now to congressional offices, especially in Florida, is to solve the healthcare crisis. If you remember when they passed the big ugly bill just a few months ago, it was the largest cut to healthcare in the history of the country to provide massive tax breaks to the ultra wealthy, and people are rejecting that. This is a time of an affordability squeeze. And tax breaks for the ultra wealthy are not the top of the list. Grocery bills, and especially affordable and accessible health insurance is, because health insurance, health coverage involves everyone. So the 4 million Floridians who are bracing for these higher costs, that's going to actually impact everyone, because if you have health insurance through an employer, you're going to still be waiting longer in an ER. When people don't have coverage, they're going to spread the cost to people who do have coverage. So it's in everyone's best interest to extend these tax credits so that folks can afford it and their costs aren't passed on to other neighbors.
We're talking with Tampa Congresswoman Kathy Castor, a Democrat, about this shutdown. Are you worried about Affordable Care Act subsidies going away? And what do you want lawmakers to know about how the shutdown is affecting you? You can call us 813-755-6562. Send an email to, we're at FloridaMatters@WUSF.org. That number again, 813-755-6562. So, I mean, the longer the shutdown goes on, though, Congressman, the more pain it's going to cause to people who are in federal government. We spoke to Republican Vern Buchanan a couple of weeks ago when the shutdown was about to start. He said there are some things that Democrats and Republicans agree on. I mean, do you see any common ground? Because I'm not hearing a lot from either you or from other folks on the other side of the aisle.
Yeah, when you're I think we could find common ground, but again, it's difficult when the speaker has the Republicans on an extended vacation. But like I said, it's really now up to the president. And what we've seen over the past couple of weeks is he's taking advantage and kind of relishing this shutdown, using it as a way to fire dedicated public servants. And I think that takes away from their argument of, boy, this is going to cause a lot of pain to federal workers. That is true, but he's inflicting greater pain. And then off on these tangents of crazy social media memes and talking about whether or not he's going to take a $230 million settlement from the Department of Justice. And folks just want an end to the chaos. They want you to focus. They want everyone to focus on solving problems and tackling this affordability squeeze.
Just in the last 30 seconds or so we have here, I mean, you know, the president has kind of taken aim at some of the federal government anyway. So, I mean, does the Democratic Party have any leverage at all if he's saying, well, if the shutdown continues, I'm just going to fire more people?
The power is with the people. And right now, it doesn't matter if you're a Democrat, Republican, or an independent. You rely 4.7 million Floridians actually rely on the Affordable Care Act, but it's the depth and breadth is deeper in that. It affects everyone. Everyone relies on affordable care to survive, and they've taken a hatchet to it. They've never liked it, and we've drawn a line in the sand.
We're going to have to leave it there. Representative Kathy Castor, Democrat representing District 14. Thank you so much for your insights. Really appreciate it. Later in the program, you will hear from a federal worker who is affected by the shutdown. But up next, the city of Clearwater wants to become an autism-certified city. So what does that mean? We'll talk about it when Florida Matters Live and Local continues.
On the next Fresh Air, what's happening with the American economy? How constantly changing tariffs, AI, the immigration crackdown, and uncertainty in the job and stock market affect everything from the global economy to our daily lives. We speak with Zanny Mitten-Beddoes, editor-in-chief of The Economist. Join us.
Fresh Air can now be heard weeknights, Monday through Thursday at 7 o'clock.
WUSF depends on contributions from people like you. And David Reynolds Jewelry and Coin, Tampa Bay's gold, silver, and platinum bullion and coin source. David Reynolds Jewelry and Coin, all that glitters, bought and sold, on the corner of Central Avenue and 40th Street in St. Pete. Humana and Sun City Senior Care, dedicated to offering whole-person health and wellness through health plans and health care. Other providers are available in the Humana network. Providers may also contract with other plan sponsors. Learn more at healththatcares.com.
Welcome back to Florida Matters Live and Local. I'm Matthew Petty. Clearwater is working to become an autism-certified city. It would be the first autism-certified city in Florida, so what does that involve, and what accommodations can it offer to people with autism and their families? If you have some insights, call and share your take. We're at 813-755-6562. That's 813-755-6562. You can also send us an email, FloridaMatters@WUSF.org. Well, Clearwater is one of the region's largest cities, one of its biggest tourist attractions. Basically, the city is exploring the idea of getting city government, healthcare, education, tourism, and other businesses trained to serve individuals with autism and cognitive differences. Here's Mayor Bruce Rector talking about it with Bay News 9.
It's really about just making sure that everyone knows that that Clearwater cares about folks with autism and families dealing with autism. And we want to make their experience here, whether they live here or visiting, the best it can possibly be.
All right, so what does this all mean? Well, joining us now are some of the folks who are involved to explain how this could change Clearwater. And perhaps you are a person with autism, or you have a loved one, or somebody who socially interacts, communicates, and processes information in a neurodivergent way. So what does this news mean to you? Give us a call, 813-755-6562. That's 813-755-6562. Send us an email, FloridaMatters@WUSF.org. Joining us is Matt Spence. He's the Executive Director of LIFT. It's a non-profit focusing on neurodivergency and includes a school as well in Clearwater. Matt, thank you so much for being with us.
Well, thank you for having me here, Matt.
Also with us is Myron Pincombe, CEO of the International Board of Credentialing and Continuing Education Standards. They train and certify places and people in autism, neurodiversity, and accessibility. Myron, thank you as well.
Thank you, Matt. Glad to be here.
And with us too is Lindsay Knight, who is a frequent tourist in Clearwater and Orlando. Lindsay, thanks so much for stopping by as well.
You're welcome. Thanks for having me.
All right, so Myron, I just want to start with you, if I could. What does Clearwater have to do to become autism certified? What's involved? How long is it going to take?
Matt, thank you. It's a great question. So we have similar initiatives going on in about 40 cities globally. But as the mayor said, our goal is really to make sure that experience is great for both visitors and residents alike. So we really look at the basic services throughout the city. So we look at tourism and recreation, healthcare, education, public safety, and then workplace inclusion. Mm-hmm. And we have a formula that we look at based on population and the kind of the industry and revenue streams for each city to see what their focus is. But we want a sampling of all companies in those different areas, and just to make sure that it gives residents and tourists the confidence that if they're going to go to healthcare or if it's a tourist that's flying into the airport, that the city not only cares, but they're trained and certified, and there's some accountability tied to their to the guest experience.
So if I'm a business and I want to be part of this, what do I need to do? Like, what kind of training would I undergo?
Sure. So all the training is industry and position specific. So it's not a one size fits all, but
sure.
What the requirements are is 80% of the guest facing, or if you're in healthcare, patient facing staff have to complete the training. And then we also do an on-site audit for each facility. And during those audits, our consultants give them tips and different ways to better serve this population. So once those two things are gone together, and there's annual training as well. So it's not a check the box type activity.
Yeah.
It's a 5-year certification, and there's annual touch points.
Yeah, I mean, that sounds like a lot of work if you've got to do a site visit for every single business that is signing on to this.
It is, but this is a much bigger population than most people think. So if you just look at the autism piece in the U.S., 1 in 31 children are diagnosed with autism. And we go a little bit broader than autism when you're looking at all the different sensory areas. and 1 in 6 people are diagnosed with a sensory disability. So it's a large percent of their current guest population, and then there's also a very large untapped market out there for these businesses.
Yeah, Matt, if I could bring you into this conversation, we were talking a little bit before we got on air, and you mentioned the amount, the sort of money tied up in the tourism industry, if it were to cater to folks with autism or other neurodivergencies.
Yeah, just in the United States alone, it's estimated that's about an $8 billion annual industry for disability travel. So you're talking about a really significant impact on any local economy, and on the number of families that make up that investment. There's a lot of folks who will benefit from this training.
Matt, what does autism certification mean to you? I mean, if you think about what it would take for Clearwater to be autism certified, what does it look like?
Yeah, so there's kind of two parts to it, the way we look at it. First and foremost, LIFT became a certified autism center in August. We sent every single one of our instructional staff and school leadership through a 14 CEU training, and then the rest of our administrative staff and our board of directors all went through the training as well. So we're 100% across the board trained, and that process took some investment of time and money as well. And what we know is that now we are better equipped to work with the population that we see every day, and that's what we want to happen beyond our school walls as well. We want the rest of the community to really be open and responsive and understanding of the unique challenges that our students and their families face.
Lindsay Knight, if I could turn to you, you live in Rochester, but you visit Clearwater in Florida frequently, and I understand you've got kids with autism. Just tell me a little bit, if you could, about the challenges you face traveling and what it would mean for you for Clearwater to become autism certified, and for more of these businesses and other locations who have that kind of training under their belt.
Absolutely. So we travel frequently. We have 3 autistic children, and I'm also an autism certified travel advisor through IBCCES. So it's personal to me, as well as my business, because our family loves Clearwater. We started coming several years ago, and we found Clearwater very welcoming to our family. Autism presents itself differently in all 3 of our children, and we've just been very comfortable. The hotels that we've stayed in have been very accommodating. We frequent Clearwater Marine Aquarium. My kids do the summer camp there. They've always helped them deep dive into their interests and their STEMs. Nobody bats an eye. We use the Culture City app that they have to find quiet places, sensory backpacks that have headphones or earmuffs and fidgets to help them through their day. But just knowing that Clearwater would be a certified autism-friendly city would mean so much to us. Just that recognition that they've gone through the training, and that almost everyone we encounter will be familiar with autism, and it just won't have the stigma that it does in so many places.
We're talking about Clearwater's bid to become an autism certified city. It would be the first in Florida if and when it does get that certification. If you've got some insights into this, give us a call. If you have family members with autism or other neurodivergencies, and this is something you think about when you're traveling or in your own sort of day-to-day business, give us a call. 813-755-6562 is the number. You can also reach out to us via email, FloridaMatters@WUSF.org. Matt, just kind of back to the cost, if I could for a moment. Is there a cost associated with getting the certification that you were talking about?
There is, yeah. Because the certification is so thorough, because the materials are excellent, and because of the investment from IBCCES on the site visit and the support that they offer ongoing, it does have a cost with it, and it's usually laid out over multiple years because you want to continue to improve your practices and then be prepared for recertification. So we're working with local organizations. Hopefully we'll be able to build a training fund so that an organization or a business who maybe can't afford the full cost of it can look to offset that cost. So we're working toward that right now.
Lindsay, what does, if I could ask, what does a bad experience kind of feel like or look like for you and your family? Like, have you had some kind of horror stories that, this is the way not to do things?
We do, but it hasn't happened in Clearwater.
Yeah.
With autism, sensory overload can happen, and it can happen very easily and when you least expect it. So meltdowns happen, screaming, stimming, it happens. And for people to just be aware that it's not anything to be afraid of. Parents usually have it under control. If there's somewhere quiet that we can go, but sometimes we can't make it there. So it's embarrassing. It's embarrassing for parents and embarrassing for the autistic person. My kids have talked to me about that. So we talk about how it's nothing to be embarrassed about. And if more people were aware of autism and what it looks like in real life, it would be less embarrassing, and we could just kind of get through that moment and then get up, recollect ourselves, and continue on with our day.
You have to develop a bit of a thick skin? I mean, have you had to sort of, and I'm wondering too, do you have to kind of strategize like where you're going to go, and if you're going to a place where we're not sure how much experience they've had interacting with folks with autism and their families, like how are we going to negotiate that?
Absolutely. Every new experience isn't really new when we do it. We watch YouTube videos, we talk about it, connect with people that have gone before. So that's why things like social stories are so important. The Culture City app that I mentioned, they have that for CMA. And just, I'll call restaurants. I want to know what options they have for dietary restrictions. I want to know is there accessible parking nearby. You have to have a plan. You can't be as spontaneous. You have to have a plan and knowing, plan B, plan C, sometimes a plan D. Flexible.
Myron, I mean, is this a trend you're seeing? Are there more individual businesses and schools and healthcare organizations or even cities themselves reaching out and saying we want to get in on this?
Yes, definitely. Yeah, we see that globally. Again, I think people are really starting to realize the size of the population. Again, when you look at 1 in 6 people have some sort of a sensory disorder, it's a large piece of the population. And we're seeing it globally, and there's just a big uptick with it all around.
I'm wondering what your perspective is, Matt, because your Lyft has been around for about 12, 13 years?
That's correct.
Yeah. Are you seeing kind of more just acceptance in general in the community, or is it a constant process of education?
I would say both. Certainly I think that the community has become more and more aware of people with neurodivergence and their unique needs. And at the same time, we are always educating folks about the fact that autism and other types of neurodiversity really don't have a single way that they present, right? They don't have kind of the most common experience. Everybody is unique, and so the responses need to be unique, and it's important to just be accessible, to be open, to be really willing to kind of roll with what's going on and to help a family as they work through if their child gets dysregulated or if there's a challenge somewhere, and how to create safe spaces for that. We have sensory rooms at our school because even in an environment that is designed specifically for students with neurodiversity, we still have our moments where students get dysregulated and they need a space to calm down. There are some great local partners. The Bucks have actually 2 sensory rooms at Raymond James Stadium. There's a lot of different.
That's got to be challenging, right? Because I mean, football games, any kind of sports environment, there's a lot to see and do, and it's very noisy sometimes.
That's correct, and it can be incredibly overwhelming. It can be overstimulating, and that's often where the sensory issues come in, where a student or an adult with autism will just need to remove themselves from the situation. And yet at the same time, we don't want to make those experiences that make a community special and unique unavailable to people with a neurological difference.
Lindsay, do you have some advice for folks who, even if they're not in the city, which is looking into this in a serious way, they're interested in kind of doing what they can to be more accommodating for folks with neurodiversity and maybe on the autism spectrum?
Ask what the family needs. Ask what the person with the disability needs, and ask how you can help make their day better.
I see you nodding there, Matt.
Yes, absolutely. I think, she mentioned the word earlier of stigma. That's one of the things that our parents fear most, is that people will just step back and stare. And when you have that kind gesture or the friendly face who says, hey, is there anything I can do for you? Or how can I make this better? Or do you need some space? Just those little gestures that make a community like Clearwater special. Those are the types of things that we want to create as universal experiences.
Mm-hmm. We'll probably be checking in to see how this process goes as it unfolds. But we've been speaking with Matt Spence, Executive Director of LIFT. Matt, thank you so much.
Thank you.
Also with us, Myron Pincombe, CEO of IBCCES. Myron, thank you as well.
Thank you, Matt.
And Lindsay Knight, who's a frequent tourist in Clearwater and has some inside knowledge on what it's like to travel with autistic kids and accommodations needed there. Lindsay, thank you so much for your insights too.
Thank you.
Well, still to come, you heard earlier from Congresswoman Kathy Castor about the shutdown. We're about to hear how the impact of this federal shutdown is reverberating here in Tampa Bay. And if you're feeling it too, give us a call, 813-755-6562.
I'm Peter O'Dowd. The fighting in Gaza over the last 2 years has left the enclave in rubble. And last month, the UN Commission concluded that Israel has committed genocide against Palestinians in Gaza, with the region clinging to a fragile peace deal. We'll speak with one of the UN commissioners next time on Here and Now.
Coming up at 1 after Florida Matters Live and Local.
Mike drove his family's long school bus-colored station wagon, the Enterprise, to college. It was a gas guzzler, but it got the job done. If your old car has lived a good long life but is ready to go to that parking lot in the sky, donate it to WUSF. That way, you can help WUSF get the job done by bringing fact-based news to your community. Find out more at WUSF.org.
Strass Center's Opera Tampa celebrates 30 years with 2 literary classics, The Turn of the Screw and The Shining. The Magic Flute and Macbeth end this spellbinding season, which starts in November. Tickets are available at operatampa.org. This holiday season, hunger is hitting harder than ever before. Government cuts and rising costs have left children, seniors, and families with nowhere else to turn. You can help the All Faiths Food Bank Thankful campaign now. Learn more at allfaithsfoodbank.org.
Welcome back to Florida Matters Live and Local. I'm Matthew Petty. The federal government shutdown passed the 3-week mark, and federal workers are set to miss a paycheck this Friday. Workers are furloughed, and if they're at work, they aren't getting paid, and some have been fired. There's about 31,000 federal workers in the Tampa Bay region. Are you one of those workers? Call in and talk to us about how this shutdown is affecting you and what you want your lawmakers to do to end it. We're at 813-755-6562. You can also send us an email, FloridaMatters@WUSF.org. With us is Southern Regional VP of NATCA, Dan McCabe, and NATCA is the National Air Traffic Controllers Association. Dan, thanks so much for being here. Appreciate it.
Yeah, thanks for having me. I appreciate the opportunity.
And we're also joined by Social Security Administration Union Representative Shonda Johnson. Shonda, thank you as well.
Yes, thank you for having me. I'm actually here on behalf of the American Federation of Government Employees. I sit on the council as the 4th vice president and represent about 3,000 to 4,000 employees at Social Security Administration.
And I understand you're based here in the Tampa Bay region, is that right?
Yes.
Yeah. So, I mean, for starters, Shonda, if I could start with you, how is the shutdown affecting the work that you do? And I wonder if you could talk about the kind of fact that it's gone on for 3 weeks now. You're staring down a kind of missing a paycheck on Friday. What does that look like?
It's tough. It's tough. A lot of the employees that work at Social Security Administration commute in. They're now allowing us to telework. And we have totally portable work, which means the work can easily be done at home. We are there to serve the public. We want the public to receive the benefits that they are entitled to.
Mm-hmm. Have you been furloughed yourself, though? I mean, or are you considered essential? What's the story?
So I am an accepted employee. So I have been reporting the entire time. Mm-hmm. And we are basically going in to make sure that the wheels don't fall off the wagon and make sure that the American public doesn't see any consequence to what's going on in Congress.
What about the pay, though? Like, talk to me about that, because, I mean, that is a very visceral thing, right? If you're missing a paycheck, that's going to hurt.
Yeah, so it is very tough. They did give us a creditor's letter, but most of the creditors don't acknowledge it. I did receive a phone call from a bill collector, and they were like, "Well, when are you going to be able to pay us?" I offered up a partial payment. They were like, "No, we need our payment in entirety. We need an expected date." I was like, "Well, have you been watching the news? We actually don't know when this is going to end." People are facing disconnect notices. I have coworkers that are finding it hard to make it to work because they no longer have money for gas. This is a real problem. We have families. The need for your medications don't stop. The need to seek medical care don't stop just because you don't have a check. And most businesses operate around money. So if you don't have money, you can't get the service, unfortunately.
Yeah. So, I mean, what are you thinking when you hear the rhetoric from Capitol Hill on both sides of the aisle? You're hearing people saying we need the other side to come back to the negotiating table. Are you getting a bit frustrated by the political talk up there?
It's very unsettling and very unfortunate. I've been with the federal government for 17 years, so this is not my first shutdown. I did work during the 18-day shutdown back in 2013, but this time is very different. In 2013, they were having conversations. It was documented, but now it seems that nothing is going on in Congress. The House is on recess, and it doesn't seem like ending the shutdown is a priority on either side.
We're at 813-755-6562 if you want to join the conversation, talking about the federal shutdown into its third week, now past the third week mark, I should say, and it's stretching on. Federal employees are staring down, missing a paycheck on Friday. A lot of them are furloughed. How is the shutdown affecting you? Give us a call, 813-755-6562. You can also email us at FloridaMatters@WUSF.org. Well, Dan McCabe, talk to me about what it means from the point of view of the air traffic controllers, because, I mean, they've been mentioned as people who could be potentially critical in ending the shutdown. How do you see it?
Well, and I think she just highlighted this. We've seen this movie before, and it never ends well for anybody. As far as ending it goes, we don't start them, we don't end them. We just end up stuck in the middle of them. But the controllers are doing the same job they did before the shutdown, the same job they'll do after the shutdown. They're going to work. The problem here is their job is very stressful. It's stressful on a good day. It's stressful with good weather. It's stressful with no outside circumstances playing around. But what this does is it introduces a different level of stress, right? We tell controllers, when you're doing this job, check your stress at the door. There's plenty of stress to be found at work. And so, as this goes on, and like you said, Friday rolls up, there'll be a zero paycheck, and the controllers will actually see that paycheck on Tuesday of next week will be the official date it drops. Now what? Now you're dealing with financial stress. You're dealing with childcare stress. You're dealing with everything that goes with your adult responsibilities in life, right? You have children you may need to take care of. You may have a sick parent. You have a mortgage, a car payment. And now those things are creeping into the building, and they're in the back of your head, and you may not be sleeping well. And with air traffic controllers, you need them to be on their A game 100% of the time.
Yes.
There's no room to play around with this. And so when you introduce the stress into them, you're bringing risk into a system that is risk averse.
Okay, so how do you support your members then? Like, what can you tell them? I imagine that sometimes there may be like an emergency fund that you can dip into to help folks out if they're struggling to, make a paycheck, pay a bill or something, I should say. But like, what is the limit of the help that you can provide your members?
Well, everyone's got their own story. And so the region that I represent goes from Kentucky down to St. Thomas. And, you have 60 different FAA facilities, and they're all in different places, different costs of living, different levels, different numbers of people. And, the best thing we can do is give them the real-time information, the support that they need, and really the understanding that we're all dealing with this together, because we are. Everybody is in the same boat. There are plenty of outside organizations and entities that are dropping off food, they're dropping off well wishes, and these are great, right? Anything to take your mind off of that thing. And we definitely appreciate that kind of support from the community, from industry. We do have a number of vendors that are willing to do, 0% interest loans. We're getting really good at researching deferring mortgages and things like that. But as to what Shonda was discussing, I mean, that's true to life, right? The banks aren't shut down.
Right. These are all sort of Band-Aid solutions, though, right? I mean, this is kind of like you're really just trying to stretch things along.
Correct. And unfortunately, the only people that don't have Band-Aid solutions are Congress. And, this is bipartisan politics. And, we don't want any part of that. We're stuck in the middle. We just want the government to reopen.
We're talking with Southern Regional VP of NACA, the National Air Traffic Controllers Association, Dan McCabe, and Shonda Johnson, who works for the Social Security Administration here in the Tampa Bay region and is representing the Association of Federal Government Employees. If you've got a question or a comment about the federal government shutdown, give us a call, 813-755-6562. How is it affecting you, and what do you want lawmakers to do to end this thing? 813-755-6562 is the number. Send us an email too. We're at FloridaMatters@WUSF.org. So, Shonda, I mean, what's the kind of outlook as this thing goes on? Like, do you have a game plan? Do you take it week by week? Are you just sort of hanging out and hoping that lawmakers come back to the negotiating table and you can give some good news to the members?
I'm definitely taking it day by day. I'm trying to encourage others, even though I am in the same situation as they are. We've had individuals have panic attacks at work. It's very far-reaching, and even with not just exclusive to the federal government, I've been speaking to family members, and they have given me insight saying that the industry that they work in has begun to talk about how the shutdown is going to affect their bottom line. So, although we want to highlight the federal workers and give background on what's going on and how hard it is to go day in and day out, this shutdown is not exclusive to federal workers, and we eventually all will begin to feel the pinch because as federal workers, we put into the economy, like we are the baseline. There is almost, I don't know the true number, but over 1 million individuals who work within the federal government. So if you exclude them out and they are not contributing to the economy like they were before, then it's going to affect the bottom line of every business.
Just quickly, if I could, I mean, earlier we spoke to Representative Kathy Castor here in the Tampa Bay region, and she says this is really about healthcare. I mean, when you hear that, like, does that resonate? Are you like, it's worth sort of holding out for something on healthcare, or are you more concerned with what's happening here and now?
You have to understand, I took an oath to service the vulnerable populations in the job that I do. So there's definitely concern that those individuals who are on Medicaid and Medicare receive the services that they need. I'm not in any way trying to campaign for anyone, but we do have to keep in mind that those certain benefits are there as a safety net for individuals that don't have anywhere else to turn. The job that I do, it pays me back just to hear from an individual. I'm so glad to speak with you. I really am looking forward to receive that check.
Yeah.
You just don't know what it means.
Yeah.
Now I can go and take care of this basic need or that basic need, or I can help my granddaughter with her school tuition.
Shonda,
so it is.
Shonda, we are going to have to leave it there. I'm so sorry, but I really appreciate you joining us and sharing some of your insights about how the shutdown's affecting you. We have been speaking with Shonda Johnson with AFGE and Dan McCabe with NATCA. Thank you both so very much. Well, that's our show for today. Florida Matters executive producer is Grayson Doctor. Our producer is Emily Horace. Lily Belcher is our intern. Engineers Jackson Harp and Gio Garvin. and Chandler Balcom and Malika Hollis handled the video. Subscribe to Florida Matters wherever you get your podcast and watch on WUSF's YouTube channel. Thanks.
Libraries lend out more than just books. They also check out tools or equipment. At Copenhagen's Human Library, you can check out a person.